Hello, welcome to the second part of the week three walkthrough. There we go. I can speak. All right, let me share my screen and share. And there we go. We left off, we had finished talking about genetic influences of prenatal development, and we want to, in this second part now, look at the week three overview, looking at the birth experience and the postpartum period. So let's view that as a student. There we go. So week three, birth and postpartum influences on growth and development. Hopefully you're seeing a pattern here in the way that these modules are set up. These are the course objectives for these two topics. There are your course objectives. Here is the link that will take you back to the week three module. Here is your information and lesson on the birth experience and the information and lesson on the postpartum period. So let us start with the birth experience. So here are the specific objectives for the lesson, and then the reading, excuse me, that you have available to you. And there is no particular assignment or activity for this particular content. So let's dive into the lesson. Again, this will take you back to the week three module, your lesson objectives, your reading, and then I should probably let you know that some of the pictures might be a little potentially uncomfortable. I do have some pictures that show different types of birth experiences, water birth, C-section. So there are pictures like that. There is the PowerPoint for you to review. There is a water birth and a C-section, labor and delivery there, vaginal delivery. There's also complications with pregnancy PowerPoint. And then since we have been looking at, or we'll be looking at in week four, cultural and family influences. Here are some cultural beliefs and practices that influence the birth process and at different aspects of childbirth. So these are this is just information. It might help you in week four as well. And there is no activity or assignment for the content. There will be some questions on the knowledge check. More overall questions, not necessarily about stages of labor, not something like that. It would be more just overall feelings, like maybe how the mom is feeling or the support person is feeling, or things along those lines. But again, for the knowledge check, you do have 2 attempts and there is no time limit. So what have you learned about how the birth experience can affect growth and development from the parent's perspective as well as that of the baby? So this will tie in with what you learned about the genetics and preconception. That will kind of flow together there. So let's go back to the module. And I should have actually taken us back to the page. I might change that. And let's look at the postpartum period. So the postpartum period would be the period of time after the mom has had the baby. So there are certain things that the mother experiences, things that we talk about in the early adulthood planning as well, but things that can also affect growth and development. So here are the objectives for this particular lesson. And the reading and the lesson are all together. I did not have specific separate reading for this, and no assignment specifically for the content. So looking at the postpartum period, the reading will be included there. And again, your objectives, there's the reading and the lessons, which is my PowerPoints, and then postpartum care, looking in terms of postpartum care of the mother. So especially in terms of if this would be a first baby, how the life of the family has changed, how the life of being a couple and now being a family, what that transition looks like, and how that affects not only the growth and development of the child, but the growth and development of the family, of the parents. Optimizing postpartum care, the best guidelines for care of the postpartum mom, postpartum recovery timeline. So a lot of times if you have if the mom has a vaginal delivery, they're usually in the hospital 2 days and then they come home, they go see their doctor maybe 6 weeks after that. But things like postpartum depression, the aches and pains of childbirth, just the overwhelming feelings of parenthood, those things can can last for a long time. So even at 6 months, the doctors and we as healthcare professionals should be asking questions, should be looking for anything that might be wrong, any questions that the mom or dad might have, or if there are siblings involved, kind of things that maybe they're going through as well. Looking again at other cultural practices during the postpartum period, things that happen. What do you all think about those? How might they affect growth and development? Again, no assignment for the content, and your think about it, especially looking in terms as we've done with the social determinants of health. What's the importance of a postpartum checkup, right? Are there any barriers you can think of that might keep a new mother from seeking postpartum care? In what way could socioeconomic status or access to health care affect postpartum checkups? And how would you, as a healthcare professional, perhaps help someone overcome these barriers? So this can be something that you, as the healthcare professional, can be thinking about. How can you help them? This might be something that you're looking at for your capstone project. So we will go back up to the top, and that will take us back to the module. And we, in the previous video, went over the assignments and we went over the knowledge check. So I just wanted to make sure that I, in fact, went over the 3B overview and lessons for you. So I will stop sharing. As always, please reach out. You can sign up for my student hours, my Sully hours, and you can get a hold of me on the chat. I'm happy to answer any questions that you have. And I hope that you have a great rest of your week.